and welcome back to the EWEC Facebook Live session. This is our second one, and here at the United Nations General Assembly we have lots of interesting people and lots of interesting stuff to talk about. And this session will be about the integrated health agenda, and I think that's something that all of us realize how hard it is, because we work in our own areas, but to really move things forward we know that we have to work with each other, but this collaboration can be so hard. So we're going to discuss this a little bit more and see how we can actually achieve the SDGs together, and particularly there's a focus on SDG 3 but also the linkages to some of the other SDGs today. And here I'm still Marie, and but I've got some new excellent people with me today, and I'd like them to just briefly introduce themselves. So Tanisha, if you can introduce yourself first.
Hi, I'm Tanisha and I'm from India. I'm a women deliver young leader. I've studied psychology, but I've been working in the field of sexual and reproductive health and rights for about 5 years now. Yeah.
Awesome. Yeah, and Marielle?
Hi, I'm Marielle, and I'm also a student of psychology right now. I'm one of the co-founders of Ateneo Libulan Circle, which is actually the first LGBTQ recognized organization in a Catholic university in my country.
Wow.
So we also work with disaster risk response. So more often than not, there are a lot of refugees who are an LGBTQ member. So they have a completely different set of needs. So that's what we help them on. Yeah.
Awesome. Yes, and I'm a medical student, so we have students at the table today. And we're just going to jump right into the first question, which is, when we speak about an integrated health agenda, what does that actually mean to you, Tanisha?
What it means to me is a multi-stakeholder approach and an intersectoral approach, and looking at how overall holistic well-being is being looked at. And I think government buy-in is really important to work around it, but looking at it not just in terms of services but also in terms of who are we reaching out to. So we talk about men, we talk about women, we also need to look at diverse women who are migrants, sex workers, are we looking at trans women, LGBT people. So yeah, that's what I would say.
Awesome. Yeah, Marielle?
I guess for me, since I work in the front line, an integrated health agenda would probably look at all those different people who are involved, from those who are receiving the aid, those who are providing the aid, those who are funding the aid. So from policy to finance to the health workers, to the social workers, and to those who are the beneficiaries. They need to be into the equation so that everyone knows that they're gonna be doing something, because we don't want any one of them to be very passive. So there is actually that issue wherein those who are receiving the aid have that feeling that they're only supposed to keep on receiving the aid until the end of time. So they get into this sort of system wherein they remain passive, they don't do anything, they feel, they sort of romanticize the concept of being victims. And that is one of the cases in the indigenous communities that we work with. So the empowerment of the local community and those who benefit from these kinds of programs also needs to be part of the equation. So I guess that would be a sort of an integration, and that would elevate the health system.
So you need another focus, you need another skill set to actually be brought in so that you can move things forward. Okay, excellent. Maybe we can just continue with you. That what are some of the key focus areas that you feel are neglected or lacking, and what are some of the major gaps that you see at the moment for integration?
Okay, so for me, it's something that came out of our experience. So one of the issues or the gaps that we've seen is that there's very little stress regarding the financial aspect of these integrated health programs, especially during disasters, wherein they actually deploy lots and lots of people who are involved in making the program into a reality, but there's very little accounting that has to do with it. So more often than not, the budget and the finances sometimes get very into the system of corruption as well. So in my country, in Mindanao especially, sometimes the prices of those aid materials and paraphernalia and equipment, they actually get jacked up and no one would notice. So rather than that rather than, for example, 1,000 people who would benefit from that budget, only 500 would benefit, and the rest would go to the hands of those, you know, politicians or whoever else who were who, just because there wasn't a proper or a concrete accounting or auditing that was involved in the budgeting process as well as in the in the feedback process. So I guess that's one of the gaps that needs to be taken advantage of right now. There's also that issue regarding the local understanding of culture. So, for example, a recent scenario in my country was that because of the Marawi siege, wherein there was an issue on violent extremism, and it cost hundreds of thousands of people to evacuate, and there were health workers there trying to provide ample nutrition for these people who are going hungry in the evacuation centers. But then there was an issue because apparently it fell into that time of Ramadan. So what happened was they have to fast. So your logistical process needs to work with their local culture. So if the food arrives during lunchtime, which is in between the 6 a.m. and 6 p.m., of course they're not going to eat it, and it might just spoil. So those small things that needs to be taken into account is actually one of those things that actually truly matter. I was also part of a lot of waste disposal scenarios going on, wherein kilograms and kilograms of food have to be thrown out because, you know, it didn't come at the right time. It's spoiled. No one was able to actually eat it. So again, that's another thing that needs to be taken into account. So also with indigenous communities as well, because there are certain foods that they're not allowed to eat, there are certain medicines that they don't take, and also there is this, a more concrete example would be that there is a lacking partnership between the medical doctors and the folk doctors. Because in the local communities, in the rural communities, the primary source of healthcare is the folk doctors, the healers, the bone setters, the traditional herbalists. And usually when these people come in carrying all those clinical stuff, those vaccines, in those boxes that people can't read because perhaps they don't have that literacy, and of course, you know, the medicines have all those chemical sounding names that, you know, no one could truly understand. So they don't, there's a lacking dialogue in between those two people. And perhaps if there would be a point of convergence between them, it would truly be enough to give, to establish that trust between those who receive the aid and those who are providing it.
Wow, I think these are awesome examples of the disaster setting and how both corruption, culture, food and medicine is affected by not having exactly that person with that understanding, and it really integrating the common understandings of the setting and of the people that are at risk. Now moving on to you, Tanisha, what do you think are these key focus areas and what is lacking?
So when I think of integrated health, the first thing that comes to my mind is what do we view as health? And I think that is something that one really needs to think about. Because a lot of the times when one talks about health, it's looked at more in terms of physical health, and mental health gets left out of the equation. And that is something that I really see in my country, because mental health is not looked at, and there are not enough services, there are not enough service providers, there are not enough organizations, government or non-government, working on mental health. So that I feel is something that we need to stress the urgency of, like, now and since always. Secondly, I would say in terms of what happens, like we're talking about gaps, a lot of the times, and looking at my country, I would say two things. One is a need for partnerships, like more effective partnerships between the various stakeholders that are involved, like the government and the civil society organizations, the beneficiaries, like what you were saying. And also within the government system, there's a lot of times that there are schemes put forth by the national government which don't really percolate down to the state government. So just a little more systematized way of going about it, I would say is...
Can you give an example of that?
So recently, not recently, like but it's recent in the sense like it's just been a couple of years. There's been a scheme launched called the RKSK, which in English would mean the National Adolescent Health Program, and the government has really shown a lot of enthusiasm about implementing it. However, as it's going down to the state levels, and knowing that India is such a large country and there are like lots of states there. There are some states that are working on it. There are some states who are trying to see how they can start looking at it, and there are some states where there's just no conversation around it.
Right.
So you know that there is a scheme in mind. We know that there could be a lot of good work coming out of this, but it's just taking so much time because the system is not very coordinated. And also what I wanted to say, again similar to what you were saying, is the need for youth-friendly services. Just looking at how young people are such a huge demographic, and the services that exist are not youth-friendly. They are not. Like, let's face it, they are really not youth-friendly, and implementation and youth-friendly services need to really come together. And I would like to give an example here. Like, there was this time that I was doing this work in Bihar, and we heard from some of the organizations there that the government took out schemes around menstruation, for which they wanted to distribute pads, menstrual pads, and they made pads available at some school setups or at the primary healthcare centers, but the quality of these pads was not great. So people would not take it up. So can we look at how so many resources have been spent on it, time has been spent on it, but the quality is not good. So it's actually not exactly solving the purpose. So
sure.
Yeah.
I also wonder, with regards to mental health and integration of this within youth-friendly services, and your focus on sexual minorities as well, are there particular issues around this as well that are challenging?
Yeah, there are a lot of issues. I don't know how to go into them, but I think mental health needs to be looked at majorly, overarchingly for all age groups, young people in particular, because there are lots of stresses that young people are going through in terms of, you know, right from livelihood to sustainability to sexuality and all of these things. And we hear so many conversations around depression and anxiety that have become common nowadays, but there's so much under the mental health umbrella, which needs, you need awareness around it, you need people to break stigma around it so that there is access to services and health. So, and when it comes to LGBT people, I would say that in my work around it, there's so many times where, so firstly, it's still a country where 377 is criminalizes homosexuality, and so firstly that is a whole other what do you call it, that's advocacy going on that level, and that is one thing that needs to be looked at. But even in terms, so we don't know where all the LGBT people are, right? Because there are so many people who haven't come out yet, who don't have access to networks where there are networks that exist, but then there are so many people who are not a part of them. And then even people who are a part of them, and if they are seeking mental health help, they are not, like, it's not very easy to find out queer-friendly therapists or queer-friendly psychiatrists. So there's just like various levels of work that needs to be done.
Yeah, so many barriers, and we do know that suicides are one of the major killers of adolescents, and we also know that transgender and the whole LGBT population is particularly vulnerable to mental health. So I think that's definitely something where all of this knowledge we have must be integrated, as you say, inside in the health system, right? And in the services that we provide. But moving on to Marielle, what do you think can be done to provide a more holistic approach to health and well-being of adolescents and youth?
I guess I would like to simply echo a common theme that has been playing, I guess, for this entire week, which is to integrate the youth and the adolescents into the equation, to allow them the opportunity to be actors in these schemes. Because there is actually that presumption that in order for you to help out, you need to be a professional, you need to have certification, you need to have licenses, when that is actually not the case. For example, during last 2016, April 2016, there was this case called the Kidapawan massacre, wherein farmers were actually being open-fired by the government because they were seeking for food outside the Department of Food and Agriculture. So there were actually a lot of them who were disbanded, who were taken, placed into these sort of makeshift buildings, makeshift evacuation centers by the police, and they were all about to get filed as a case just by being there, just by rallying against their local government. So it's like, what is happening here? And the most amazing thing is the first few people who went there, who provided paralegal aid, who wrote down all of their testimonies, because it's part of creating that sort of documents in order to counter the case that was being filed against them, were actually college students, were actually those who were out of school youth who just followed a template on how to write a document, on how to talk to people, how to transcribe their situation. And it was them who wrote more than 500 papers all night. They didn't even sleep at all. And because of that, because of those documents, very few, I think less than 10 were actually sentenced to courts. And it was because of their work that it allowed actually more people, a lot of other NGOs, a lot of other university students to come into contact, because they inspired these other youth that says that you don't have to be a lawyer to help out legally with these people. And the fascinating thing is that these youth, these young adolescents, actually simply reacted to a tweet. They just reacted. They're not, some of them aren't even members of an advocacy organization. Some of them never advocated for anything at all. They just went there. They just saw, oh my gosh, there's something happening in Kidapawan. Okay, I'm gonna hitch a ride a bus, go there, ask how I can help.
That's awesome. That's an awesome example of how youth can really be operational, and we're impatient to change and help out, right?
Exactly.
But how can we be more holistic? What should be done in this sense, like to allow it? To allow it. Okay. So for that, perhaps there is a requirement for us to integrate the youth as well as the adolescent faction into a lot of those dialogues, a lot of those meetings, a lot of those programs in the creation process. So prior to actually establishing those disaster risk response schemes, prior to actually creating all of these agendas for women, for children, for the LGBTQ, there needs to be a voice, there needs to be adequate representation from the youth factor, not only in the university level, but also those in the local community, such as local government units, such as those of the out-of-school youth, because they're also under that program if it will be, of course, approved. So, for example, in a situation, there was a national women's congregation that happened in order to forward a comprehensive bill for women's rights in the Philippines. And the thing was, most of the people who were there were the elderly, were these people who were privileged members of political families. And there was very little representation from the youth. So more often than not, the programs that were established, even in the health agenda, even in the security agenda, all of those were really issues that didn't actually primarily affect the youth, such as, for example, the school. What's happening in our education systems? What's the quality of education? How can we counter depression, which is one of the, as you said before, a leading case of also suicide as well as mortality rate in our youth, about the HIV and AIDS. Because of some conservatives there, they won't even talk about HIV and AIDS unless a young person would outrightly say, hey, we haven't talked about LGBTQ, we haven't talked about the HIV and AIDS situation in our country. So for that holistic thing to actually happen, it's really as simple as sending an invitation. Come to this meeting. Maybe I can just lead that on to you. So what role do you actually think that gender and sexuality play in driving progress for adolescents and youth forward? And maybe we can link it to what you were already talking about.
I'll just say what I was going. I was just going to say what you were saying in just like different words. Is like what she's saying. It's absolutely necessary. Like we need young people to be there at various levels. So it's not just that young people are involved in every organization or in policy or in the government, but young people need to be there right from the needs assessment to the program designing to the implementation to the monitoring and evaluation. As young people, if young people are a majority of your beneficiaries, let young people ideate and actually think about ways in which the services that are being provided will be taken up very effectively. And I think young people have a role to play hugely in this regard. Coming to gender and sexuality, I would say sexuality, as we know, is a central aspect of life. Gender becomes a part of it. It shapes the way we are brought up. It shapes a lot of things, right, from how one is, supposed to behave, to talk, with the possibilities that one sees ahead of you. Your choices are in a lot of ways influenced by what you feel is appropriate or inappropriate to your gender. If you don't fit into the so-called socially acceptable boxes of masculinity and femininity, there is no end to the discrimination that you face with it. And alongside that, just young people growing up, adolescents, there's just so much information nowadays around, where there's the internet, it's just like this generation of information boom, and we know that there are doubts around these issues, and it's not always, it's in fact not just not always, it's difficult to find accurate and age appropriate information that you can say is actually reliable for young people. So you Google things and you get like 50 links and you don't know which are the two which are maybe actually giving you the right kind of information. So this is where I would say, and my work has also mostly been centered around this, that there is a need for comprehensive sexuality education. And I would like to really stress here that comprehensive sexuality education is the term that is preferred and not sex ed. Because sex ed gives the impression that it's about sex, but that is not what comprehensive sexuality education is. It covers everything right from gender roles, to consent, to looking at violence, to looking at child sexual abuse, to, you talk about safe, unsafe and confused touch. So and all of these things coming together, I feel really are important for physical and mental well-being that we were talking about. So physical health and mental health.
So you think that comprehensive sexuality education actually can provide the world with a more comfortable population, maybe?
Because then you have the right kind of information to make informed decisions.
Right.
We still don't know how informed the decisions would be, but at least there has been an effort in that direction, right? Sure. And also one more thing, it's important that comprehensive sexuality education is from a pleasure affirming perspective. And what I mean by this is that usually when we talk to young people, it's around a very disease prevention or violence prevention. So we get ready to talk about sexuality with young people because we want to talk about sexual violence, or we want to talk about child abuse, or we want to talk about HIV, or we want to talk about STIs. But when you want to talk about consent, it becomes controversial. So one has to look at the fact that it has to be pleasure affirming, because if we again talk about sexuality with young people from a fear-based sort of a perspective, then we're sort of, it kind of reiterates the stigma and the silence around it.
Is that something that you have found challenging in your own work yourself, or do you want to share some of the challenges that
around sexuality education? I would say in India there is no sexuality education that is mandated by the government. So there are some government schools that have a curriculum. There are some private schools that on their own have tried to implement some sort of a curriculum, because with every passing day, more and more schools are realizing the need to talk to young people about it, and they want to make efforts in that direction. However, because there is nothing that is actually mandated, we don't know what approach who is applying. So some may be, maybe only talking about menstruation. Some may be talking about the whole gamut of things that we want should be spoken about. Some may be talking from an abstinence-based perspective. So there is really no accountability, which is why there's a lot of work going on in terms of advocacy with the government to say that this is the need of the hour. Look at your demographic, look at the population. Long back when there was a comprehensive sexuality education curriculum brought up, and it was banned in several states of the country, saying that this is against Indian values. Is it? Have we seen our population? Everyone's having sex. Let's talk about it.
And how is it being a young woman trying to advocate for these things? Is it challenging, or do you feel listened to? Do you have examples of how?
I would say I have been lucky in this sense, right from the fact that my parents have been supportive. They also ask me things and they learn around it. my friends have also, I think there have been a lot of conversations around it, and they also now, like we all think back to our school days and we see how this is something that should have been really important. But I would say for me, just keeping in mind my context, more problems are in the professional sense, in terms of, you know, like you are working in organizations, we want to make this change happen, but a lot of the time and effort and energy is spent around strategizing of how the agenda can be pushed forward, because you can't just walk up to a government official and say we want pleasure-affirming sexuality education.
You need a bit more than that.
Yeah.
And what about you, Marielle? What challenges have you faced in your work?
I guess my challenge would probably be psychosocial support, not only just for those who were recently recipients of a victimizing situation, but also for those who volunteer. So more often than not, when we go to these crisis situations, we're just, we are affected by a lot of other things. Psychologically, we're very emotional. And sometimes when it gets too long or when it gets too intense, the situation, because it's still very fresh. Because of that freshness of situation. Sometimes even us, we experience compassion fatigue. And just imagine listening to 500 people talking about that kind of incident wherein these providers of food of our country are actually being attacked by their own government. And sometimes it gets to a point wherein you're just nodding to that person. You can no longer feel empathic even though you want to. And so a lot of our volunteers, a lot of our health workers actually break down. And so they have to go home. And then after that, they will never be the same. A lot of people, after volunteering once for 1 week, they will no longer come back to help because something changes, something alters in them. So definitely, it's one of those things that I rarely see in programs in Asia even. There's no proper psychosocial support for those who provide psychosocial support, because you know we're also human as well. And especially for me as an LGBTQ and going to all these sometimes Muslim communities or indigenous communities, they would immediately try to sort of discriminate against you, even though you're the one providing for help. And also the government is like watching you like a vulture behind your back. So it's like you're an enemy to everyone. You're a human rights advocate, but even the government is saying that you're unnecessary. Especially right now with the current state of my government, our Commission of Human Rights only was given just 1,000 pesos. That's roughly $20 budget for this year because of a certain situation that's happening. And so all of us human rights advocates are currently being viewed as enemies of the state. And so imagine all of those pressures going down on you. Imagine you as, I'm still a student, I frequently absent in class just to do these things, and a lot of other volunteers frequently absent as well, because the youth and the adolescents actually have more free time rather than those who are working because of the minimum wage. So other people who has that intention to help cannot. So only us who are students can, but you know, even the school system is trying to forbid us, trying to tell us, no, don't. You have to make your assignments first. You have to do your quizzes. That's more important. Is it really more important than what's happening right now in the situation? So imagine all of those people discouraging you. So how can you even help when you yourself need that kind of help? So that's definitely the main issue right now that we're having.
That's interesting. That's really true. There's some organizations back in my country who are looking at working with other non-governmental organizations. And you know, in terms, actually, there's just one organization. I used to work with them earlier called Tarshi. So they work on burnout prevention and self-care for people working in feminist organizations and working with sexuality and across the board issues. It's really important. I think even like within our own, you know, network of young people who are all working in this sector, there's often a lot of disillusionment because the change is slow and the passion is high. So it's like, what are we doing?
And I have to say, like, I'm so proud to sit here with you two today, and despite all the challenges that we have, that you keep pushing. And I think it was excellent to talk as well about compassion fatigue. I think that's a really important point. And actually, an integrated health agenda is not only about the patients or quality of services, but it's also about about the providers and about making these connections, whether they're in the sexuality field or whether they're within disasters. But it's so important that we manage to make these connections and integrating these surveys to connect the dots. And I think that ends or finalizes our little session here. And thank you so much for watching. We'll be back.
Thank you so much for having me.